participation today is your implied consent to be recorded and posted on RNAO's website. Our presentation for today is titled Nursing Leadership in Long-Term Care Homes. And our keynote speakers are Sushem Subedi and also Inderpreet Hundal. Sushem is a senior nursing manager at Poston Village in Halton region. She's been working in long-term care for the last 9 years, doing various leadership roles and also quality improvement. She's been in a senior leadership role for the past 4 years and is currently doing her master's in health management with a focus on healthcare policy at McMaster University. We also have Inderpreet Hundal. She's a registered nurse who have over 15 years of clinical experience, and she's completed her master's in nursing, specializing in geriatric care. And before joining Halton region as the professional practice lead and BPSO liaison, she's worked as an associate professor in India and also an associate director of care in Sugar Villages, responsive management, and also universal care. She believes in utilizing evidence-based practice to improve clinical outcomes in Halton region long-term care homes. At this time, I would like to welcome Sushem and Inderpreet.
Inderpreet, you're muted, I believe.
I'm sorry. Welcome everyone for the Nursing Leadership at Halton Region webinar. Hi everyone, this is Inderpreet. So a little bit about the Halton Region. Halton Region is a BPSO designated organization designated in 2019. The Halton region has 3 long-term care homes, that is Allendale Long-Term Care Home in Milton, Creekway Village in Burlington, and Poston Village in Oakville. So far, we have implemented 4 BPGs, which are person and family-centered care, preventing and addressing abuse and neglect, preventing falls and reducing injuries from falls, and nursing leadership. At present, Poston Village is implementing nursing leadership and collaborative practice in 2022. Moving to our presentation for the nursing leadership at Halton region. So what's in it for me in this webinar? So it's introducing the transformational leadership, 5 practices for the transformation leaders, practice changes that was implemented at Halton, that is include executive and interprofessional team level, and transformational leadership at Halton, and how we make it fly and happen at the Halton. So leadership training and work plan activities will be discussed. So why does leadership matter? Leadership matters because people matter. It is important to encourage and empower frontline team members and build the capacity at the home level to utilize knowledge to action framework with evidence-based practice to bring out the best clinical practices at the home level. So point of care leadership tips and tools for the nurses. Why is it important to have a nursing leadership? To promote evidence-based practice and culture, positive impact for the clinical outcomes and best clinical practices, to promote clinical decision-making, and improve job satisfaction and staff retention at home, modeling, leading, advocating for quality improvement and evaluation. So what's in it for me? That is why nursing leadership is important for the frontline team members to gain awareness regarding to CNO requirements for professional and reflective practice, developing leadership behaviors, interprofessional support and mentoring, better growth opportunities, improving communication techniques, gaining knowledge, clinical expertise, and improving processes, And of course, engaging in the project implementation. Next is about the transformational leadership. So 5 practices which revolves around the registered staff for the better clinical leaders, or 5 practices of the transformational leaders includes building relationship and trust, empowering others, support knowledge integration, leading, support and sustaining change, and balancing complexities and competing priorities. How we utilize those 5 practices in the Halton region for the transformational leadership. First one was building relationship and trust. Relationships include those formed between the individual nurses, teams, residents, and partnership with other organizations, which included advocacy and support for the families, residents, staff in navigating process, consistent timely communication, which was utilized through the PSW reporting tools and assertive care conferences, participating in interprofessional committees, professional and educational opportunities through the Nurses Week celebration, speaking engagements, and webinars with in collaboration with the RNAO, assuming responsibilities according to the full scope for the delivery of the care, utilizing the evidence-based practice, be a visible leader, and keeping the commitments with the families and the residents. Also influencing the delivery of care and services through the application of the evidence-based practice and knowledge to action framework, both at the home level as well as the divisional level. Next practice, creating an empowering work environment with the open, honest, and by clear communication through active listening, seeking clarification, preceptorship plan for the new hires, Nurses Week knowledge fair for the discussion on the tools implemented through the best practice guidelines, clinical education plan for the PSWs, job roles and responsibilities for the nurse in charges for the professional autonomy, care committee collaborative infrastructure, and clinical leadership integration into the knowledge. It's better to say always be appreciative, ask them about the goals of the team members and supporting group, and help them to find their own strengths to build up and empower the team and work environment. Supporting knowledge integration, creating a culture that supports knowledge development and integration. So how we can do that? Developing and disseminating new knowledge nursing research, evidence-based practice, knowledge to action framework. Then of course, participation of the frontline team members in the committees, teams, team huddles to share the knowledge and experiences to build up in the knowledge framework, and of course, to better clinical practice, collection of data in the meaningful way through the PSW tracking tool to empower the PSWs as well, applying clinical best practices or clinical practice guidelines to improve organizational processes and outcome, and to build up the quality improvement as well. Registered staff. So for registered staff, integration of the registered staff for the reflective practices by taking the workplace projects, speaking engagements, and annual self-assessments for the knowledge integration. And also promoting the evidence-based practice and the sharing their knowledge with the other team members. Leading, supporting, and sustaining change. By creating a culture to sustain change through the point of care leadership champions, creating a shared values, roles for decision-making and collaborative practice, develop plans and timelines for the change, evaluating efficacy and linking facility goals, promoting team building for staff, balancing complexities and managing competing priorities. All registered staff completed the leadership training, personal development plan, and as a workplace project, facilitate debriefing sessions and monitor outcomes, then utilize the knowledge to action frameworks and reporting responsibilities for the decision-making, and balance the intercollaborative boundaries and developing the communication and conflict management skills, and understanding their roles, individual roles for their professional as well as their designated role into the full scope. Then is practice changes in the Halton region. Shisham, please take over.
I did. I'm not able to move the slide. Just a second here. Okay. Thank you, Inderpreet. How are we gonna make changes? By implementing the practice change at Halton. After implementation of the leadership best practice guidelines this year, we have made several evidence-based practice change to build nursing leadership at home level and also at the organization level. So at the executive level, we updated the roles and responsibilities for BPSO liaison officer, site coordinators, and for site leads. We implemented a whole brand new reporting structures and algorithms. And we did considerations for mandatory annual education for leadership for our nurses and for managers. We are evaluating the effectiveness of interprofessional collaborative practice. And we are creating structures and processes for knowledge integration with evidence-based practices into policy. It will also create opportunities for empowerment to take charge, develop transformational leadership culture to facilitate sustained change. At interprofessional level, we set the expectation for all registered nurses to complete the RNAO self-leadership assessment tool prior completion of their yearly performance appraisal with their managers. We set the expectation of all new hire registered staff of all RNs and RPN categories to complete the leadership self-assessment tool during the probationary period. We set the expectation and aim to keep the 20% of nursing team to complete the BPSO champion workshop yearly. And we have also set up a committee leads that consist of our PSWs and registered nurse to lead all the committees. So this is the leadership self-assessment tool that all nurses will utilize to do the self-assessment yearly upon new hire and also before the performance appraisal yearly. How do we make it fly? Sometimes we seem to implement a lot of the guidelines and best practice evidence tool, and sometimes majority of the times we fail to sustain. So this is very critical for all nursing leaders to make the sustainable plan so that we ensure that the implementation of best practice guidelines does not only include that year of implementation, but it carries over for years to come in LTC. So how do our plan for sustainability starts with the leadership training. Nurses work in long-term care sector face unique workplace stresses and unique challenges. So this year we started Poston Village and the Halton Region Services of Seniors supported our registered staff to attend a full day leadership education. This education was a commitment that we made to our nursing team that we are going to provide them yearly to provide them a necessary training and education to build their leadership skills. We as an organization and Poston Village also made a commitment to our frontline workers, nurses and PSWs to participate in a customer service education, which majority of our the team have already completed a full day education. And we involved our nursing team, mostly the PSWs and nurses who are working in the units and also the nurse in charge to do the gap analysis, because sometimes the gap analysis and we are able to identify a gap way better when we involve the frontline nurses than having only managers developing the action plan. So actually this year our nurses participated in developing a doing a gap analysis so that we're able to build nursing operational plans together with the gap identified on leadership and with the implementation of leadership best practice guideline. Our nurses and frontline staff are involved in many workplace improvement projects, which Interpret have already highlighted in the previous slides. Some of the examples are SPAR tool, the PSW reporting tool. We have built many IPAC champions. Our nurses have taken a formal education on IPAC, so as the managers. So this year we have created a lot of champions and committee leads as a part of the BPG Nursing Leadership Initiative. Our nurses are also included on developing a work plan for them. So this is the example of integrated gap analysis that our nurses were involved, where they identified the gap, and together with the gap that was identified at the home level, we engaged our registered staff to develop a personal and professional work development plan to elevate their own leadership styles. Sorry, I think. Just a second, I think workplace project ideas from the work plan. So some of the integration of the nursing operational plan to build nursing leadership were done by nurses. So where they did the poster presentation on SPAR tool, PSW reporting tool during the Nurses Week. We had an open house and knowledge fair for nurses in Nurses Week as well, and which our team is committed on doing it every year, not only this year because we are doing the nursing leadership, so it has to sustain. Our management team is committed on supporting our nurses. We also did a BPSO champion shine of seat for clinical program leads, which many nurses have signed up and have participated. So finding a joy. So it's very easy to implement the guidelines, but we also have to motivate our nursing team to find a joy on themselves when they do the nursing leadership. So in order to do that, our nursing team and managers are committed on supporting our nursing team, learning broadly about lifelong learning, finding strength of others. We focus on our team's success, not individual success, aligning personal values with organizational values, which is our Halton Region Services for Seniors, and also humbling and gratifying journey to be our LTC healthcare leader. LTC nurses being resilient. In order to build a nursing leadership among nurses and to get that strength and build capacity, the biggest part of the leadership is for nurses to learn to become resilient. They have all the nurses in long-term care. It is very important to reach out for support and adapt to the changing situations daily. As you develop your leadership skills, being resilient is one of the skills that we must learn as a leader. It is important that we learn how to manage stress, reach out for support when we need help, adapt it to the new changing clinical guidelines and roles and expectations. And what it is not is you are not going to do it alone. We must as a leaders provide a support system in place so that we are there for our nurses to support them when they need help. Nurses leaders learning to do self-care. It is very important when you try to build resiliency on yourself, you have to also learn to do self-care for yourself. So we encourage our nurses, like building leadership, taking part in initiative and project is an extra initiative from our team. So we always encourage them to take time for themselves, to involve in practice change that maintain health and well-being, to find pleasure in small things, finding a ways to fill your tank. We need to be healthy. We need to be emotionally well. We need to have resiliency among ourselves to decrease the frustration among the challenges that come with the leadership skills and able to thrive in the LTC sector. So we really promote our nurses to take care of themselves and manage stress while they are working. Advice to future long-term care nursing leaders. Leadership is a long journey. As I myself take a very long journey of almost 9 years of nursing LTC experience, it takes a while to build that resiliency, get that ability to work in LTC. We have to always focus on our employees' strength, understand the strength of those you need and emphasize on their strength. Do not focus on being a content expert, focus on building a relationship. Not every career path is a ladder. Make lateral moves, small steps. It will allow you to gain knowledge in other areas and demonstrate leadership. Concentrate on team's strength. It's the success of the team that will that will help us sustain our leadership and implement evidence practice guidelines in our LTC. And if you aren't scared or doing something new on a weekly basis, it's time to move on. We have to train our nurses to adapt with the changes that happens in healthcare, to build resilience and get that strength to adapt to the changes. Look for a fit between your personal values and that of the organization. As you find interest on what interests you, let your managers know, and that's how we are going to build the future LTC leaders. If you have any questions, we interpret and I will be able to, we'll do our best to answer all your questions, and we are ready for questions now.
Thank you so much, Sishem and Inderpreet. That was a very brilliant presentation that you put together for us. And it's really great to hear from you about, how you're helping your nurses and your staff within your homes to develop those leadership skills. We have a few questions from our participants. Our very first question is from Jeff, and he asks, what is the PSW reporting tool that you're using? You mentioned that you're using a PSW reporting tool. What is that tool, and was that tool developed by you or adapted from someone else?
Thank you, Jeff. It's actually a really good question. So this tool was developed by a group of nurses and our clinical resource nurse for the home, who is a registered nurse. There were many tools that you could have also easily adapted, but our team decided that they are going to build this tool based on our gap analysis. So what this tool is, every time our nurses do the transfer of accountability to the other shift, and there was no formal structure on for PSWs to do a formal TOA to the nurse who is going to end that shift. So this tool is about a few key areas which highlights any skin tears, any falls, any concern of the residents, any lack of food and fluid intake by the residents during the shift. So each PSWs will report to the nurse before the end of the shift, about 30 minutes or 45 minutes early, on any high-level concerns that they have observed or have documented on their shift. If you want, I'll be glad to share you the tool that we have created. If you can send me a quick email, I can share with you, Jeff. But it's basically a transfer of accountability from the PSW to the nurse who's working on that home area for that shift. That's all it is.
Thank you, Sishem. There's another question from Ashley. And she's asking, do you have any suggestions or strategies to use to keep your staff motivated to come to work regularly, given the situation what's happening with the pandemic, and also there are issues around chronic absenteeism in long-term care?
Oh, this is such a great question, Ashley. You know, like I'm sure myself in Poston Village, I face with the similar challenges, but I have to tell you what works the most is as a healthcare leaders and the manager for the home who is leading the nursing department, you have to build those relationships with your employees. I think I can proudly say the Poston Village leadership team has an excellent relationship with our nurses and with our team. Our offices have an open door policy. That means unless we are in a scheduled meeting or something that requires to close the door, that's the only time, even myself as a director of care, I closed my door. Respond to your emails, voice messages of your employee in a very timely manner, and try to find a way to work with them when they need a time off. I think that's what will work, will reduce the absenteeism, because everybody has during this pandemic a lot of issues with childcare. A lot of so many children are studying from home. You know, it's very hard for our employees, just like us, to balance the work life and the home life. So therefore, I think we must find a flexibility. I think that's where we will find success, and we will have to find a unique way to work with our team. I think that's what I would say is a success for being a Poston Village. We have only utilized one PSW for 3 days from the agency for throughout the pandemic. We never utilized agency staff, which I'm very proud of. If we really need, we will utilize, but that tells you that we are able to run our home with our own employees, and you must find that relationship building, flexibility, getting to know your employee, and just making those small changes, what you need in advance, by responding to their emails on a timely manner, by calling them and just trying to find a way to work with them. I hope that helps, Ashley, but it is a challenge for all the healthcare sector.
Yeah, Shisham, I will just add on something like that. Being a leader, you should acknowledge their work and just create a sense of working together. And I feel that recognizing their work and them as important team members, it's always make a positive influence to the team members, and they're ready to work. And this is my experience throughout my working as a director of care. So it's good that you are bringing out that question to, especially in this pandemic and working in the hard time. So that's Shisham has elaborated very well, and we are really thankful to our team members who have really helped us on that time. Thank you.
And it's also great to see you implementing that guideline, because I think it's also a way of supporting your staff. Yes. And developing that leadership with your staff. So the guideline itself from RNAO is helping you to do that, to build that leadership and help to sustain it over time. Yeah. We do have another question from one of our participants, and they're asking, just in regards to involvement of staff, how do you inspire staff to get involved in this initiative that you're doing right now? Given, you know, the shortages and everything that's been happening, like, how do you get them engaged? How do you get them excited about what you're doing?
I have to tell you, it's been quite a bit of a challenge, because, you know, when leadership initiative and projects are implemented, you know, we expect our nurses to do it within their 8-hour shift or within their assigned shift. It's almost impossible for all the healthcare organizations to replace them because they are working on a project or anything like that. So this has been a very big challenge. I think finding a strength on your employee is the first step. You make it available for all your employees, and you as a leader will also know among your staff which staff is interested on which projects, and maybe this might interest you. And you know, not everybody can be a leader. Not everybody wants to be a leader, and not everybody has the capacity to be a leader. And I think we always have to find the strength they have. And also what we've been doing is we've been doing a lot of individual conversations as well and trying to empower them. But I have to tell you this, to get that motivation and to get that excitement and to work, this considers as leadership development as an extra effort that our nurses are giving to our team and to our organization is extra in terms of PSW. I have a lot of success with the registered staff because the CNO expects all registered staff to demonstrate leadership, be a preceptor, participate in the projects. With the PSWs, there was a few challenges, but identifying strength and having that individual one-to-one conversation, empowering them helps. That's what we have done. But this is like I said, implementation of leadership and building capacity within home is a lifelong project for the long-term care. It cannot be only we implemented leadership this year and this is what we are doing. This has to continue over and sustain over the years to come.
That's great. And just looking at the chat, there are a lot of respondents or participants saying that they really love the tool that you're using for leadership assessment. And also they would love to have a copy of that, and also the one that you're using for your PSW staff at handover, because they think it would be a great tool that they can also use in their home. And there's another question here from one of our participants. They asked, do you pay your registered staff to do the leadership assessment, self-assessment, and do their work plans, or are they expected to find the time in their day to do so?
So it usually, it depends. So if it's like a casual employee who does not work very often and who have actually come to the home to do it, maybe in some cases, but usually when nurses do their leadership, we just started this year, the leadership assessment prior to doing the performance appraisal. So usually performance appraisals are done within our shift. So as the leadership assessment that the nurses are completing it at their own time. And how our nurses have taken this is also to also as a mandatory competency from the CNO, because the CNO also expects all the registered nurses to maintain their competency levels. So I think this year many of the nurses did the leadership component to maintain the competency level. So I didn't I have received only positive feedback from the employees, and they are expected to do on their own time, unless at many exceptional circumstances that they have to come just to do this, and because they are a casual employees. But I haven't paid so far.
Okay. And do you have any suggestions on tools that you might be able to use, like for building relationships? Because you mentioned about the importance of building relationships with your staff. Were there any particular tools that you use, or any suggestions of what you can do to help build that relationship with staff?
And, tool sounds like an excellent plan. I can give some thoughts on researching some tools, even with the best practice websites and stuff. We were actually trying to create a focus group, because since we are implementing a collaborative practice next year in 2022, we were actually in the process of creating like a focus group where nurses will have some open day session to have a join with the managers, and we can discuss on how they are feeling and kind of building relationship, like what needs to be done on the manager level and what needs to be done at the employee level. But I can definitely look, but I do not have any like outline tool at this point on the building relationship.
Okay. There's another question asking about, you mentioned in your presentation about using the transformational leadership model and creating a whole new culture around that model. We're just wondering, how has the culture shifted in your home, and has this helped with your sustainability plans?
Interpret, do you want to answer this question
sure,
as
sure.
you worked a lot in the regional level, to sustain?
Yeah, sure, Shisham. I will go ahead. So we focused on promoting the team building for the staff, for sure. The focus group, which just Shisham mentioned just now, and briefly meetings with the team, one-to-one conversation. And it was nothing, whenever the change comes, it's not an easy thing. Change is always for the betterment, but for sure it do take time and eventually the lot of struggle and manpower around that. So building that team capacity and empowerment through the leadership education. So that was a very good, like a collaboration with that on the education and continuous involvement through the self-assessment and the self-need assessment on the clinical practices basic. Another thing I will just stress on that is our team is very much involved in understanding or evolving the clinical needs as I'm working through in the divisional level as well. So I have seen team members are approaching me around like a new policy changes as per the needs of the home or as per the clinical needs of the residents. So it's one-to-one back-to-back process, I will just say. And of course, the understanding their individual roles at, like, for example, nurse in charges, they're understanding their role, building that capacity at that level, empowering them, and then coming up with the ideas and then acknowledging their acknowledging their needs as well. So it's not that, okay, we are shuffling off. It's like we are acknowledging what they are bringing it up on the table, and we are supporting them in collaboration with the leaders as well as the home team. So that's how we build up that change and sustain that change. Still now we are working on, like, still we are working. It's not the leadership is a one-day course. It has to be ongoing. But so far we have worked through that in that way.
That's great to hear. How have you managed the complexities that you've just faced with your environment, and how did you prioritize some of this work that you're doing within your home?
Mm-hmm. So we make sure that we are team is participating in the committee meetings, team meetings, and for sure we have a divisional level IPAC meetings for all 3 homes. We have divisional level, like we are working on skin and wound. So divisional level meeting as well at the home level meeting, bringing out all the capacity team members, PSW, RPNs, RNs, especially the life enrichment team members as well on the board, so that we can bring empower them and build the capacity at the home level. Then utilizing the knowledge to action framework as well as evidence-based practice, and working together on the reporting responsibilities for the decision making as well. On the other side, of course, the leadership training, and then balancing the intra-collaborative boundaries, like working in the boundaries and working together with the other team members outside the boundaries as well, and open, clear communication with the team members.
Do you also see a connection between this particular guideline that you're implementing and the others that you've implemented?
Yeah, for sure. I can say that any guidelines, which best practice guidelines we will implement, we need some leaders, we need champions, and for sure the best practice champions are the one kind of leadership bringing out at the home level also. So any leadership, we need the champions, and that comes from the leadership. So it's collaborative. I will not say that nursing leadership is an individual best practice guideline. It is in collaboration with the addressing abuse and neglect. So coming out and addressing it and working towards that to make sure that residents are not suffering with that. And for sure, for the falls as well, we have just implemented the falls tracking tool as well in the homes as a part of the best practice guidelines. In that also, we are bringing out our PSW especially, so that they come forward, they report about the falls, what are the causes, what are the reasons, how we can make sure how we can manage our falls at the individual home level to bring out the falls rate at the home. So this is how the leadership is in collaboration with the other best practice guidelines.
Thank you so much, Inderpreet. At this point, I'd like to ask our participants if there are any further questions. I believe we've answered quite a few. For those who are inquiring about the presentation itself, it will be posted on RNAO's website. And also for those looking for the evaluation link, this will be sent to your email, and you'll have an opportunity to fill out the evaluation survey, and you'll also get the certificate of completion when you do so. So Sisham and Inderpreet, I want to just thank you for a very engaging, very insightful presentation. I think our participants really loved hearing from you and how you're, instilling leadership skills with your staff that you have at Halton Region. So it was really good to hear from you ways in which you're doing that through the transformational leadership, how you're supporting staff, how you're engaging them. It was very informative. And we want to just thank you very much for sharing with us that information.
Jamshed, thank you for facilitating this workshop, and thank you everyone. We have quite a bit of a participated today. As I was going through the chat, there is a lot of questions that a lot of our healthcare leaders would like to have the PSW reporting tool. Is there any? Should I send you the PSW reporting tool and you will be sharing with our teams in the community, or would they be reaching out to me directly?
Yes, I think it's probably best for you to share it with us, and then we can send it along with the evaluation survey information. That will be the best way for us to share it with everyone that was a part of today's call.
Perfect. Sounds like a good plan. I did see a lot of questions. I know due to the time constraint, we are not able to answer all the questions. And I do see some great questions from our family members from Poston Village, which I will definitely address it after this meeting as well.
Yeah. Thank you, Shisham and Indrapit. I think we were able to capture most of the questions in the chat. Mm-hmm. And at this time, I would just like to thank our audience or participants for engaging with us today in the webinar. We're coming to a close of the webinar for today, and you'll soon receive a link to an online survey to evaluate today's presentation. Please let us know of any suggested topics you would like us to work on. And then immediately after you have done the evaluation, you will receive your certificate of attendance, as I mentioned. I just want to let everyone know that this work is funded by the Government of Ontario. And again, thank you so much to our presenters and our participants for engaging in today's webinar. And I hope that you have a wonderful day.
Thank you so much, Jamesi. Thank you everyone for joining today. And we really enjoyed answering the questions and of course, this presentation. Thank you so much.
Thank you, everyone. Thank you.